Hey y'all, welcome to another episode of Daily Dose with Sade. It's your girl Sade, and today I wanted to talk about bullying in healthcare. First of all, to bully as nurses in 2026, it's lame. It's not okay, and y'all need to get y'all shit together. To literally bully a nurse that's trying to learn is insane. To know that you were in that position at one point in your life, all of us learned. All of us went to nursing school. All of us have the same privilege as another nurse. Just because you are off orientation or you may be a little more competent than this nurse at this time doesn't make you better than this person. Nobody is more superior than another person. Anybody can be humbled in any way. You can have one mistake or one decision that can mess up a patient or mess up the trajectory of their outcomes, thinking that you're too good or thinking that you're better than the next nurse. Bullying in healthcare is something that has always been a thing. A lot of nurses eat their young. And I'm speaking on this topic because in my last nursing video, one of my subscribers commented and said, "Could I speak on bullying and how to handle it?" As a new nurse, you're going to be timid. You're going to be scared to stick up for yourself. You're going to be scared to say when you're uncomfortable or when someone is bothering you or bullying you because you don't want to be a bother, you think that they know better than you. Nothing about that is okay. We see people self harm all the time due to bullying. We see people harm other people due to bullying. Bullying is a form of workplace violence. And don't ever be scared to speak up when you're bullied. I don't care if you're scared to be labeled as a snitch. If it's affecting you to the point where it's affecting your mental health, it's affecting patient outcomes, you should speak up. And you do the chain of command. You go to your charge nurse. If the charge nurse doesn't say anything, you go to your nurse manager, and then you go up the tier and ladder from there. When I first started off as a nurse, I started off as a student nurse, and you don't know anything. People don't understand that nursing school is the foundation, but actually getting into like nursing and getting on those units, working with real patients, and each scenario being different, and it's not textbook, you're gonna feel like you don't know anything because guess what? You don't. I don't care if you've been a nurse for 10 years, 20 years, 5 years, whatever, right? All of us started in that same position, having that feeling of, is this really for me? You know, feeling like, I feel like I'm not smart enough. I feel like I'm not good enough. I feel like this is a serious job, right? Because it's a very serious job. Nursing is very serious. Lives are in our hands, no matter what specialty you're working. For a nurse to look at another nurse, a baby nurse, a new grad, knowing that you felt the same exact way coming out of nursing school, you were that nurse. Everyone literally was that nurse. If you came out of nursing school very confident and knowing how to take care of patients or whatever, you're a dangerous person. Someone that knows it all is dangerous, literally, and that's scary. Don't mistake anxiety for not being good enough. That's your mind, right? That's your mental telling you that I know the risk. I'm scared because this is, first of all, new for me. This is scary. I don't know anything. This is a new environment. When your body gets into an uncomfortable state, it either goes into fight or flight. Anxiety is not always a bad thing. This is specifically for new nurses, new grads, or nurses that have just switched specialties and are on a new unit right now that are getting bullied by anyone in the healthcare field. Because doctors can bully nurses too. I see doctors bully the intensivists at my job bully the residents. I see it all the time, and it's not okay because unfortunately, not enough of us speak up when we see it happening. I was a new grad. I started out in cardiac surgery ICU. They are known to eat their young. I feel like you have to learn, and this is just for all nurses. Early on, you have to learn to speak up for yourself. If you can speak up for yourself without being confrontational, you can set the tone that you need respect without being confrontational. You are not going to survive in the nursing field without speaking up for yourself because people are going to run over you. And that's just the truth. Now, as a healthcare worker, you got to know what to entertain because at the end of the day, this is a professional setting, correct? You have to learn what to entertain and what to speak on. You're not being bullied because someone was being miserable, right? Bullying is when the specific person is constantly pointing you out or constantly taunting you or constantly making you feel less than, talking about you to other coworkers, and it's an ongoing thing. That's not okay. So you first of all you handle that by speaking up for yourself. If you don't have the guts to speak up for yourself, find somebody that has the guts to speak up for you on your behalf. It's people out here. Find that charge nurse that don't fuck around. Find your preceptor. And if it is your preceptor, ask for another preceptor. Because this is what I learned. If you are being precepted by a nurse that you think is bullying you, you are not going to learn how to be a nurse. And guess whose license is going to be affected by that? Yours. You cannot be scared to ask questions because I've been there. I had a job when I was a student nurse. I got offered a job where I was a student nurse at when I first graduated nursing school. They scared me so bad when I was a student nurse. I was scared to ask questions. I did my practicum there as well. I was so scared to ask questions because I didn't want to feel dumb, right? It was a unit where they made you feel dumb for asking certain things. Like, I would ask something that clearly I don't know. I'm a new grad, like I'm a new nurse. At that time I still was in nursing school. So to learn, like, asking questions should be a healthy thing. You should even no question is a dumb question when you're working with patients. Especially this is the time coming out as a new grad, being a new nurse, going to a new specialty. This is the time to ask the dumbest questions ever because you're going to get a pass for it. You should get a pass for it because you don't know these things. But unfortunately, that's not always the case. Some people judge you. Some people think they're superior, which for whatever reason I don't know, because a lot of times it's projection. A lot of times people like to put down others to make themselves seem higher. And when they're not in the nursing setting and when they go home, they're fucking losers. People that are losers in real life are bullies or think they're the best nurse in the world on those floors where they feel the most confident. Imagine being scared to ask a question that's pertinent to the patient population that you're taking care of. And then when you're by yourself because you never asked that question, and now because the thing about it is when you're on orientation, these are the times to make mistakes and ask questions to learn, right? This is the time to learn because when you are off orientation, they expect you to know certain things. Now, I'm not saying that they just leave you out, throw you into the fire. If you're having a crashing patient or something happens, of course, you're always going to have support, but certain things you should know. And they're going to expect you to know these things because they expect you to ask your preceptor these things. A good nurse doesn't just carry out tasks. No matter the specialty, you have to utilize critical thinking skills. And that's something that is learned over time. So as while you're on your orientation, you should have a preceptor that helps you start to develop those critical thinking skills, right? You want to know your why. You don't want to just give meds because they're ordered. You want to know your why. Why am I doing these things? Why does my patient look like this? If I give these fluids, how does that benefit the patient? How does that make the patient worse? What does that do for their kidney function? You want to know all of these things. And it's unfortunate that we're in a time where nurses can't even ask other nurses questions without feeling like they're dumb or they're being judged. It's actually sad. And that's why I said in my last video that nursing has changed, because people aren't as compassionate as they used to be. It was a little bit more compassion. Now, nurses were always like hard on each other. They always was messy. Let's say messy. People are messy. You got a lot of messy individuals. But you had some good preceptors. And we just don't have that anymore. We don't have those preceptors that really took the time to teach you how to be a nurse. Now they're just judging you. And mind you, this is not everywhere. But what you want to do is think about your license. If you feel like you are being bullied, please escalate that. It's a time and a place for everything. It's a way that you say things. Once you become a nurse, you realize that everything you do when you're in that hospital, in that clinic, or wherever you're working at is strictly professional. So handle yourself in a professional manner. You can't get slick with someone that says something that may have been out of pocket, or may have been shady, or been very passive aggressive, because that's what you're going to get a lot in nursing. There's a lot of passive aggression. You're going to see it all the time. You have to know what to entertain. And literally, for the sake of your license, entertain nothing. Literally. Until it affects you. If you see the same, like I said, the same person, it's nothing wrong with saying, hey, and you don't do it in front of everyone. Hey, you said this, and that wasn't okay. Or I feel like I'm not being supported in this manner because every time I ask you questions, you make me feel like I am inadequate or that I'm not competent. It's ways to talk to someone. A lot of times, those passive aggressive people, when you pull them up to the side, they're going to do one or two things: downplay it or cry. I'm telling you, there's always crocodile tears. So, what you do is, hopefully, it's not your preceptor. You keep a smile on your face, not let them know that it affects you. You don't handle it emotionally out loud. You be strategic about it, very strategic. You go up in your chain of command about it if you pull this person up and it still hasn't changed. Um, and if it's someone that's a doctor, I'm telling you, confidence just comes with time. It literally just comes with time. And you literally have to have some thick skin to work in healthcare. Because sometimes people going to say stuff y'all don't like. It don't make it okay, but it happens. And it's going to happen. I'm not even going to lie to y'all. It's literally going to happen all the time. You got to take your emotions out of it. Switch your preceptor. If it's not working, and you know when it's not working, if you're afraid to ask questions, if your preceptor seems like they're a drill sergeant, I'm telling you, early on, switch. And that's not to say that a preceptor being tough on you is your reason to switch, right? Because a good preceptor is going to be on you, especially when you're getting close to being off orientation and you're starting to do more things independently. They should be hard on you. They shouldn't be disrespectful. It's a difference. Your preceptor telling you, hey, you should know this when you make a mistake. I was expecting you to notice and you didn't notice. It's not bullying. So know the difference. Your preceptor saying, what the fuck are you doing? And you see them talking to your other coworkers and they're like, you hear them whispering like you're stupid or you're not going to make it on the unit. Now that's bullying. A good preceptor is going to be on you. I'm just letting you know that right now. I used to be on my orientees. No, what are you doing? But also, I'm not talking about them to other people. We're going to talk about this right here. Hey, I taught you that. But I don't think that I'm bigger or better than anyone because I was in that seat. I was them at one point. I didn't know anything. I made mistakes. I was nervous. I was scared to talk to doctors. All of it. You have the same degree. I don't care if they've been a nurse longer than you. They might have more expertise than you. They may have more critical thinking skills than you. That doesn't make them better than you. And don't let them tell you otherwise. You have to work in an environment that prioritizes patient care. You can always tell when there's a disconnect in the staff on a unit. You can tell by the patient outcomes. When you have staff that are close knit and that trust each other and you don't have a lot of drama, patient outcomes are different. And I'm telling you this because I work multiple jobs and I know through experience. Patients survive more often than not. Doctors and nurses get along. I've been in environments where the doctors and nurses, they're not on one accord, or the nurses don't trust each other. And guess what? Guess who's affected by that more than you? The patients. Patients die all the time due to mishaps in a hospital that has nothing to do with their outcome, but the fact that a nurse may have done something because she was scared to speak up, or they're not trusting each other during the code, like the doctors and nurses, they're not on one accord, they can't communicate effectively. All of this affects patients. It's unfortunate that it's still happening to this day, but I really wish that that would come to an end. It's 2026. This is a new era of healthcare. Nobody should be bullying anyone. We all started somewhere. And the ones that feel like they're bullied right now, I promise you, you're going to be okay. You're going to look back a year from now, 2 years from now, and you're going to realize, I'm okay. I am competent. I was able to come through that and get out of that because I am enough and I'm meant to be here. Don't let nobody make you feel like you're not meant to be where you are right now. You worked hard for it. We all were in the same boat. I promise you, even when people don't want to admit it, I promise you we were. So just take it easy on yourself. Go up the chain of command. Don't let nobody play with y'all. I don't care if you only been a nurse for a week. Don't let nobody play with y'all because it's not okay. It's not normal and it's not okay. But that's my spiel for today, y'all. Um, we're gonna talk about more stuff coming in the next few weeks, next few days. But yeah, let me know how y'all feel about this video. And all of my seasoned nurses, for the sake of it, can y'all please comment some words of encouragement and some advice for some new grads that are currently going through bullying in the workplace, or just need words of encouragement right now if they're having, imposter syndrome or anything. That would be lovely. Make sure y'all like and subscribe as always. And until next time, all right, y'all. Bye.